In Killmeyer. We are on the eve of the holiday season, and Huntsville Hospital reports only a handful of patients are being treated for severe illness related to COVID-19 right now. Statewide, hospital numbers are also down more than 100 from the same time a year ago to less than 200 patients statewide.
But along the top of the state, Colbert, Lauderdale, Limestone, Madison, and Jackson counties are reporting medium community levels, which means an increased impact from cases and hospitalizations. News 19 Chief Investigative Reporter Brian Lawson joining us now in the studio. And Brian, the COVID numbers look favorable even compared to last year, but we saw a big change around this time a year ago, right?
Yeah, we did. We definitely hope history will not repeat itself. Thanksgiving last year saw 9 more COVID patients than we have at Huntsville Hospital right now. But a year ago, we went from 74 patients overall in the hospital system on November 22nd to 94 a month later to 514 patients by the end of January. That was a 594% jump in 2 months. I spoke today to Dr. Wes Stubblefield of the Alabama Department of Public Health. He said a number of things are different this year, and flu spread might be a more immediate concern.
Many people have had at least their primary series when it comes to COVID vaccine. There is residual protection, even if it's not against infection, against hospitalization. Many people have also had COVID, potentially multiple times. The bivalent booster, and then the lessening severity of the variants as opposed to the ancestral strain, sort of all play together. What I've been advising people to do is to make sure that if they have those in their family or in their circles where they're gathering that are among the very young or the older population, or potentially people who have underlying medical conditions, those are the 3 risk groups that we think about. And those stretch across both RSV, COVID, and influenza.
Looking at COVID-19 in Alabama, there have been 1.54 million cases since 2020. There have been 20,617 deaths. People should consider wearing a mask if they are at risk and the community level is medium or high. That's currently the case, as we mentioned, in the Shoals, Limestone, Madison, and Jackson counties. Now, Dr. Stubblefield said a harsher COVID strain could emerge, but the hope is that it will become like flu with vaccination and treatments available. Jerry?